Dr. Frezza here at the Chiropractic and Injury Center in Levittown. Today we're going to be talking about lower back and hip pain. Today we're going to be using our dry spine here, my skinny girlfriend. What we want to talk about, what we want to look at, are the hips and pelvis. The hips and pelvis are 6 bones. There are 3 bones on one side and there are 3 bones on the other, and they kind of come together to form your pelvis, like jigsaw puzzle pieces come together. When everything's in position, it's not an issue. What we see a lot are that hips and pelvis, instead of being where it's supposed to be in position, they move or jostle out of position. When they do that, it can cause low back pain, it can cause hip pain, but more importantly what happens is it causes the leg length to change. Right? The legs should be even or level, but because the legs are connected to the pelvis, as that hip and pelvis moves or jostles out of position, the legs are connected and it causes one leg to be shorter than the other. That doesn't sound like a big deal, but over the course of time, if you're walking around with one leg being an inch or so shorter than the other, it can cause some fairly severe low back pain and some hip pain. A best example would be to go into the closet and get a high heel shoe, put it on one side, and a flat shoe on the other. Walk around for a day or two that way. Again, as the leg length changes, the hips and pelvis are going to change. And what's going to happen in a real short period of time is you're going to notice some low back pain and some hip pain. If you do that for a real long period of time, that pain is going to get more severe, and what's going to happen is you're going to start to become arthritic. So we see these issues quite a bit, and what we do is we go in and we gently adjust the bones of the hips and pelvis, put everything back into their proper position, and what we can do is we can correct that discrepancy in the leg length. So what we're going to do today is we're going to do a little bit of a demonstration. We have Laura, one of the people who work here at the office, laying on the table. She's laying face down. And what we want to do is just real quick, we want to kind of check her leg length. And what we're seeing is that this left side here is about 3/4 of an inch, maybe an inch shorter than the opposite side. All right, so again, almost like having a high heel shoe on one side and a flat on the other. Now, it's not her legs where the discrepancy is at. It has to do more with her hips and pelvis, up and through here, right, the way the bones fit together. So what we're going to find in a case like that is the person is going to have some low back pain, they're going to have some muscle spasm, and they're going to have some inflammation. So from a chiropractic standpoint, what we want to do is go in and take those hips or pelvis that are out of place and put them back into the proper position. So we're going to kind of demonstrate that today. We do that using a side posture type of an adjustment. So Laura, I'd like for you to lie on your right side for me and face me. So this is pretty standard. Most of the chiropractors do the side posture adjusting. So I'm going to go in, make the correction on one side, and have her turn to the other side. Sorry. Make the correction on the opposite side. So I'm going to have you lay face down again. So we go in, check. Alright, so really without even touching, you can see that left leg has grown about 3/4 of an inch to an inch. Again, we didn't do anything to her legs. It had to do with the way the hips and pelvis have come together. I see these issues a lot. The majority of patients who come into the office with low back pain and with hip pain, this is one of the underlying issues and one of the underlying causes. If we can go in, if we can make some changes over the course of time, usually with a condition like this, somewhere inside of about 3 to 6 weeks, the person is feeling a whole heck of a lot better, and about the 3-month mark, you can actually go in and you can fix or stabilize these types of issues. So if you're someone who has chronic low back and hip pain, and you've run through the gamut with medical doctors and even other chiropractors, and you're just not getting the relief that you need, we welcome you to come on in. Let us take a look, let us diagnose the problem, and see if it's something that we can't fix for you. Again, this is Dr. Frezza here at the Chiropractic and Injury Center in Levittown, and I thank you for watching this video.